My name is Katie Buitrago, and I am the Director of Heartland Alliance's Social Impact Research Center, dedicated to empowering data-informed decision-making that drives systemic change. Thanks to all of you for tuning in. This work can only be done together with help. And I want to let you know that this happens to be the 20th anniversary of our research into poverty in Illinois. In our most recent signature report, The COVID-19 Domino Effect, How the Pandemic Deepened Systemic Oppression for Black and Latino Illinoisans, we have seen how COVID-19 and its social and economic impacts have disproportionately harmed Black and Latino communities here in Illinois. We have seen increased healthcare barriers for BIPOC communities, increased hardship for workers deemed essential, and a severe lack of support for individuals and families navigating an increasingly unforgivable economy. These inequities are results of a generations-old racist systems and attitudes that have continued to foster a racial gap in health and wealth. In our continued fight to achieve equity and opportunity for all, Heartland Alliance's direct service and policy teams see these injustices and respond to them on a daily basis. Data from this past year provides critical insights into the impact that COVID has had on Black and Brown communities. Even as we enter a new stage of life as COVID-19, the people we serve continue to face challenges and barriers that were exacerbated by this last year. In our continuing efforts to achieve equity and opportunity for all, we have convened leaders from across Heartland Alliance to provide perspective on how the findings from this report reflects the challenges faced by the people we serve. Joining me today is Mary Tornabene, who is a nurse practitioner and project lead for Heartland Alliance Health's citywide vaccination program for vulnerable populations. Lakeisha Swoop, who is a supervisor for our Supportive Services for Veterans and Families program, providing housing solutions and employment opportunities for veterans experiencing homelessness. And Barbara Martinez, manager of our asset building program, connecting vulnerable populations to tools and services that help families build. And as we discuss inequities seen during the pandemic, the disproportionate healthcare outcomes that fall along racial lines are especially stark. Data shows that Latino Illinoisans got infected with COVID-19 at disproportionately high rates, while Black Illinoisans were dying from COVID-19 at disproportionately high rates. And while all of this is happening, our report found that Latino Illinoisans lack health insurance during the pandemic at a rate twice as high as Illinois overall. We know there have been barriers to healthcare during the pandemic, and these barriers have lasted for generations before that. Mary, what do you think we need to do to reduce those barriers?
Well, racism is a complex public health emergency, and because the complex is so multifaceted, the solutions must be as well. Using a trauma-informed lens and led by voices of lived experience, we need to build equitable and accountable systems of care. We need to address the social determinants of health at systemic levels and equip our healthcare force with the knowledge and skills to understand how these factors collide and they impact health and how to attack and dismantle systemic inequities. We need to be accountable for ensuring that all people have access to high-quality healthcare within their community, that all Americans must have affordable health insurance through a single-payer system or through expansion of the Affordable Care Act. We have to increase diversity, belonging, and conversations within our communities and workplaces. We need a healthcare workforce that must be expanded in a way that is reflective of the community it serves, both culturally and linguistically. We need to eliminate clinician-side barriers to care, such as mandating expanded hours of operation, walk-in and same-day access to primary and behavioral health care, and we need to do some re-education to eliminate racial bias. Increasing access to behavioral health care, because and undertreated mental illness and substance use create a vicious cycle of poverty, incarceration, homelessness, and poor health. Thank you.
Thank you, Mary, and thank you for sharing those ideas. That really goes to show that there have been generations of the healthcare system eroding trust among Black and Latino communities, and I think a lot of those solutions can try to change some of those systemic barriers. And I'm going to shift to talking with Barbara. As we all know, the pandemic has also resulted in economic and unemployment crisis. Our report shows that Latinos were most likely to spend down their wealth and use credit to get by during the pandemic. Barbara, can you talk about what that looked like during the past year for your participants, and how can we help people bounce back from this situation?
Absolutely. Thank you very much. Yes, we saw a lot of our participants, especially at the beginning of the pandemic, seeing their hours being reduced or just altogether losing employment. That had to do a lot because a lot of the participants that we serve work in industry that were directly impacted by the pandemic, like such as the hospitality industry, retail. A lot of those employments were affected because of the stay-at-home orders. So a lot of those families that lost employment, they had a cascading effect. Some of them, when they lost employment, they had to move in with family members. That increased the amount of people living, for example, in one household. That had effects of like being fearful about the pandemic itself, getting sick maybe, or more, mouths to feed, but no enough income to come in. So a lot of people use all credit that they had available in order to put food on the table, or sell whatever they had available in order to put food on the table. But keep in mind that even before the pandemic, people were living paycheck to paycheck. And I read in a study like recently that a lot of the Illinois people that are applying for rental assistance, they were using like 70% of their income to pay for rent. So imagine somebody was using 70% of their income to pay for rent. That means that 30%, so 30 cents of every dollar was available to pay for everything else. That means entertainment, transportation, healthcare, and 70 cents for rent. So 1 month without income because you lose employment, that means that piles up, and another month without income, that piles up. And that is like a big hole that got filled with bills and bills. So the debt that they had now is even bigger because they put more things on the credit card. So that is the reality of a lot of our participants that they are still trying to get out of because this is not over for them. So what can we do? Well, here at Heartland, we have incredible partners and funders that had allow us to modify some of the programs that we have to react to that reality. And for example, I can give you an example. One of the asset building programs that we have used to match savings for our participants. But based on these realities, we knew that during the pandemic, our participants were unlikely to be able to save. So some of our partners allow us to change the model. So instead of having participants save and we match, we did direct cash transfers when they needed the funds. And by doing this, we were reacting to the pandemic's effects to the participants and helping them when they needed the most.
Thank you so much, Barbara, for sharing how your program was able to be flexible and responsive to our participants' needs. And one thing that we found in the report as well, one of the people we talked to was a undocumented Latina immigrant who, when she and her husband lost employment, she wasn't able to access a lot of the public benefits because of her undocumented status. So they really had to spend all of their life savings in order to keep food on the table. So that's another factor in play as well.
Yeah. And what I have to say about that's another thing that we did as Heartland is we collaborated with other partners to create like Get My Payment Illinois and coalitions like that, so we can find out what pockets of money were available for example, undocumented individuals in Illinois, so they can tap into that. And for example, in my Resurrection Project, they did have a fund available that people like her could have applied for. So by knowing this information, we could connect residents like her to those. So it was like by being creative and being able to like know that people were struggling and connect with every resource that we had in our power to react to it and be there for our participants, that we were able to react and help them in their moment of need.
Thank you. That's really incredible. Moving on to Lakeisha, the data show that Black and Latino populations faced higher unemployment rates during COVID-19. As a supervisor of a program dedicated in part to helping people with employment, Lakeisha, what sort of barriers are you seeing for the people you serve as they try to find jobs, and how is your program responding?
Yes, absolutely. One thing we realized during COVID was that even though there was a lot of resources available, they was not always accessible. Some programs require a lot of documents that people could not access at the time. For example, we had a veteran who needed documentation to show that he had a special type of driver's license, but as we know, the DMV was closed for a great deal of time. Another veteran in our program was trying to transfer from the food industry, and When looking for opportunities, he could not find those things, and also found that even trainings he needed to apply for jobs was not available during the time. We also saw that people who already was either new to the workforce or already had extenuating circumstances found even more difficulties during COVID. We have several veterans who aren't the most tech savvy individuals, and they had a hard time applying for things in a world that no longer communicated physically, but virtually. Even we are assisting individuals remotely. So it can be tricky to support people through Zoom and help them find work virtually. Besides the technology gap, in general, it was just not many jobs available and still not available. Our employment placement coordinator works to connect our veterans to jobs that meet their needs and skill set because we have a goal of making sure our veterans are able to work in longevity and stability. The variety of jobs that are normally available are no longer available. So we have had to go out as a team and create new partnerships and kind of shift jobs that came about in the new COVID world. Lastly, a barrier that we saw was safety. A majority of the individuals we serve are Black and Brown, and they understood that numbers of increased infections or deaths among this population was real. This hit close to home for our participants as they experienced episodes of diagnosis and deaths among themselves and their families. It's scary out there, and it's not easy to expect people to go back to working minimum wage for minimum compensation, putting their life at risk.
Thank you, Lakeisha, and that's really important. There's lots of research showing that a lot of essential workers are at higher risk of getting COVID-19, and when you're not dealing with high job quality, I can see it could be a difficult trade-off to make. So thanks for sharing that experience. And then I just wanted to stick with you for another question. By that same token, the pandemic showed us how critically important it is to have safe housing. We're currently seeing that Black and Latino Illinoisans experienced higher levels of housing instability during the pandemic and are now at higher risk of eviction. The people you serve often come to you after experiencing homelessness. Can you speak to why it's crucial that we build new supports for housing stability as we look to hopefully a world with less COVID in it?
Yes, no, absolutely. We first must take into consideration what housing means. Housing means an individual has stability and they have independence. It helps build their confidence and helps establish the foundation for security and success. No doubt, housing was impacted by COVID. For those that were in housing during the time, we saw income loss and increased needs that put their budget in the red. Prices for basic necessities were at all-time high. And so COVID resources and funding really allow these individuals to have a safety net. For those who did not have housing within the searching process, housing leads came in much slower. Our team worked diligently to house people during this time, but the unknown of COVID led to things moving at a slower pace. For those who do not have housing, we were able to place them in hotels and provide other necessities to ensure everyone was safe. And now, as we enter this new version of COVID, it feels like we're going to pull these safety nets that were so needed for so many people. These safety nets allow so many people to swim and maintain during the pandemic. Everyone's not ready for that net to be removed, and this is understandable. Looking back at the root of things, I wholeheartedly believe in housing first philosophies. We need to remove any and all barriers to housing completely. There are multiple responsibilities an individual has to take on when they go into housing. Income is not the only deciding factor. For example, community plays a big role in helping someone feel safe in their home. With COVID, churches, food pantries, and other local businesses have been shut down, with some sadly never not reopening. These staples of the community played a big role in filling the gap in resources and being a part of an individual support network. We have to acknowledge that we are still working through this pandemic and that things have changed. It is not realistic that everyone will be ready due to us all learning how to adjust in this new world. I believe we cannot truthfully expect anyone to return to the old way of things when we are living in a new world.
Thank you, Lakeisha. I think that's a really important point. And while the pandemic was devastating for so many, one silver lining is that I think there was a lot of innovation in how we get supports to people and reducing a lot of restrictions and barriers. For example, on the healthcare front, you know, you didn't have to reapply for Medicaid during the pandemic. And do we really want to take these supports away from people when they've really been needed for so long, not just in these crisis situations? So thank you for making that point. And, Barbara, just as there has been an eviction moratorium that has protected renters from being kicked out of their homes, there have also been nationwide foreclosure protections to help homeowners and keep their homes and stay housed during the pandemic. But data from our report suggests that Black and Latino families are more likely to be behind on their mortgage, and they might have a big bill come due when these protections disappear. Barbara, what will we need to do to protect these families and keep them in their homes as the pandemic protections wind down?
I think so. I know that there's a lot of relief government funds that are on the way. So we just have to do whatever it takes to protect those families and keep them housed until that relief becomes a real recovery, and we have time to do that. And just to give you an example, we have a program called the Financial Navigator. In the last 2 months, our team has spoken to about 400 Chicago residents, the majority of them experiencing financial distress because of COVID and needing either rental assistance or mortgage assistance because they are at risk of being evicted or having their house foreclosed because they are behind 2 or more months on rent or in mortgage. So even if they apply, they still have to be their application process, and their landlord or bank need to receive the funds for them to be able to stay in their house and not the legal procedure not to take place. So the government needs to allow for that to happen because the funds have been allocated, and now they just need to be given to the right institution. It will be a shame to put all those families on the street in the time where we have now new strains of COVID, when we have come so far. The fight in Congress to allocate that money, that was the biggest challenge. We already won that fight. We just need a little time to make the funds get to the right people. So that's one thing. And the next thing is to continue fighting in the policy front. So in the future, we can create a world where people can have salaries that are wages that are like livable wages, and that we can have health insurance so everybody can go to see their doctors when they have to. And there's a lot of progress being made. Now everybody's going to be receiving the tax credit for their children, and that will be done automatically, and people are going to be receiving that on their checking account, direct deposit, and that will help, and it will be a game changer for a lot of families that we serve. Those is a result of all the advocacy and work that people like in Harlan have done for so many years. We have to continue doing work like that so we can move forward. Work to remove predatory products from the market, work to remove and make possible so people can have like benefits, so they can take vacation time, so that they can rest and have enjoyable lives. So all those things need to happen. So when the next pandemic comes, because that's something that we can't stop, this is not the same scenario again. I think that those are the things that we can do. So.
Thank you, Barbara. I think there's a lot of talk about returning back to normal, but maybe we need a new normal where we didn't have some of these inequities that happened before the pandemic. So thank you. And then I'll take it back to Mary. The data we looked at found that Black and Latino women in particular experienced concerning mental health symptoms during the pandemic. For example, increased reports of symptoms of depression and anxiety. Mary, have you seen this in your work? And can you talk about what the factors contributing to this increase in mental health symptoms might be during the pandemic?
Yes, I actually have seen a lot of this in our health centers, as have my coworkers. The pandemic of COVID was added to a pandemic of racism that we already had. And for women of color, pre-COVID race and gender inequities were really exacerbated. The balance of work and caregiving really placed an enormous burden on them. And then there was the economic impact of pandemic shutdowns. It hit hotels and restaurants and retail and education. And these sectors really disproportionately employ Black and Latino women. Over 41% of Latino women and 67.5% of Black women are primary or sole breadwinners for their family. And when they lose their job, it really impairs their ability to care for and to house their families. Families were hard hit and experienced food insecurity, housing insecurity, and an increase in domestic violence. And for those women who didn't lose their jobs and were essential workers, they were out, often on public transportation during the height of the pandemic. The fear and the impact of bringing COVID-19 home to family members, multi-generational families, it was deadly. We know in Chicago, Black residents had higher death rates, and Latinx and immigrant neighborhoods had highest infection rates. There's the education component that put a lot of stress on women. There was significant underinvestment in Black and Latinx communities and schools. And when the education of children first went remote, 1 in 5 children under the age of 18 lacked internet access in Chicago. While much work has been done to ensure education access for these children, the initial and ongoing struggle women in these communities faced to protect themselves and their families, to provide food and lodging and educate their children, has really been overwhelming. For Latinx women, especially those who were undocumented, they survived 4 years of not knowing who was knocking on their door, of looking over their shoulders, and if not permanent residents, debating whether or not they should take the food stamps and public insurance. In Black women, the individual and collective trauma has grown exponentially during this time. Systemic oppression, macro and microaggressions, police brutality and killings, and social unrest. The most visible stress during the pandemic that we saw for our Black women came at the time of social unrest. Our participants, they told us they weren't safe, they didn't have food, and they had no way to feed or care for their families. They couldn't go out of their homes and lost access to medications and other services. So that stress has really impacted their wellness and their future.
I want to dig deeper on a thread that I'm hearing from all of your stories. It sounds like all of your participants are really struggling with housing, whether it's being able to afford their rent or that the fact that they're experiencing homelessness. Could you talk a little bit more about what the experience of your participants trying to afford housing has been like during the pandemic?
I would like to say something about what Lakeisha was talking about housing being an issue. And I have heard that a lot from our participants, especially most recently when we have talked to a lot of people in Chicago that have called the financial navigator line. Housing is very unaffordable, not only in Chicago, but in Illinois as in general. And it is very impossible to run a household when a lot of your income goes into rent or into mortgage. But a lot of our participants are mainly like renters. So one thing that we can do and encourage and advocate to the people that can make a difference is to find ways to make housing more affordable. That's something that can be done. Other nations have done it. Other states have done it. And that can be a section that is more pristine and more expensive, but they can be a big section that is more affordable for the biggest portion of the population that is more like us, like the working class. So we can have a big portion of our assets, our income, be spent in health and entertainment and education and advancing our lives. So that is something that we definitely cannot leave in the back burner. If we don't fix it, we're never going to move our families forward. We're never going to be able to close the racial wealth gap, for example.
No, Barbara, I definitely 100% agree. We complete a housing assessment with our veterans when they come into the program, and part of the goal is to make sure housing is less than 50% of their current budget at the time. We would like it to be even lesser. But that's the goal, is at least not to go over 50% of their current income, and it's just not realistic with some of the marketed units right now. So I would definitely 100% agree with that. And yeah, no, it's a something that needs to be of a long-term solution. I think with COVID just amplified it, and because resources got even tighter, we saw a lot of people doubling up, and we saw a lot of people staying in other entities like shelters or other places because they just couldn't afford to live on their own right before COVID. So COVID just amplified that issue. No, thank you for that. And I also wanted to speak on what Mary, when she was bringing up about some of the people reactions or, just living in fear and anxiety and having around COVID. And I think that is just such a good point. We're seeing now that some people are starting to, as things die down, like talk to their providers, kind of take a breath and kind of realize the mental and physical impact COVID had, besides not trying to, contract COVID, there was so many things that went into that. I know mental health has went up, and our program has hired healthcare navigators that's been referring people to a lot of resources, just because people didn't take it into consideration. It just was living in the moment, trying to stay safe, trying to stay afloat, that they didn't realize how impacted COVID was.
And to both of your points on housing, we knew that before the pandemic, homelessness was on the increase. There is no affordable housing in Chicago or really anywhere in the country. And because of the pandemic, we expect to see a 40% increase in the number of people experiencing homelessness in the next year to year and a half. And the resources that's going to take just may be insurmountable to even find.
And I wanted to say something about what Mary said about being devastated, the COVID experience for our participants. Last summer, we have participants calling us for assistance for funerals, because not only their families experience multiple deaths because of COVID, but because of the areas where they live, they are also victims of violence, of domestic violence, but also gun violence. So there were families that had too many funerals and they couldn't afford so many burials. So they were calling for assistance to bury their family members. And at that time, we were not aware of FEMA and how we could direct participants to get funds from FEMA to help them with the burial costs. Back then, we didn't know that. And we were struggling to find help for these participants. And it was devastating having those conversations with participants. So these are the participants that we need to protect, because they are in the forefront of the gun violence. They're in the forefront of COVID. They're there to get our groceries, to bring us, the Uber meals while we are home working. So that's why we have to give it our best and do whatever it takes to make sure that they stay housed and that they have a future. So
I just want to extend my thanks to all of our Heartland Alliance leaders for sharing your perspectives during this critical time. I think that while we continue to see the impacts of COVID-19 across society, it's critical that we continue to call out the disproportionate burden it has placed on the shoulders of BIPOC communities. We see the inequities, which gives us the opportunity to recognize the solutions. If we want to truly heal as a society from this pandemic, it is crucial that everyone has access to high quality, culturally competent, affordable healthcare. Everyone has the money they need to meet their basic needs. Everyone who wants to work has access to a quality job and the supports they need to stay successfully employed. And that we invest in closing the racial wealth divide so that people of color can weather emergencies and build towards prosperity. Thanks to all of you for tuning in. This work can only be done together with your help. Please visit our website at the link below to download the full report, read the stories of BIPOC Illinoisans harmed by the pandemic, and explore the data. If you haven't already, please follow us on social media channels, Facebook, Twitter, Instagram, and LinkedIn to stay updated on our work. And thank you for sticking with us.